It's certainly likely that there were Medicare patients who may have received contaminated compounded drugs in this outbreak, given back pain, arthritis being a common disease in that population. When Medicare covers the type of back pain injections by physicians in their Medicare patient population, there's generally a global payment that goes to the physician for that, and not a specific payment for the drug being used. So it's likely that Medicare may not have been aware of the specific drugs being used, and they were not specifically covering any particular drug in this case. When the regulatory environment has implemented by the FDA and the payment and insurance environment has implemented through the Medicare, Medicaid programs of CMS, create an environment in which compounding of drugs on a large scale flourishes, but those drugs aren't tested appropriately before they're marketed and aren't manufactured to the highest standards we expect of a drug company, and then distributed on a massive scale to the population at large on the scale of 10,000, hundreds of thousands of patients, then we have the potential for a public health catastrophe like we have ongoing now. But when you have a compounding pharmacy acting like a drug company without all the protections that the regulations are intended to implement, we can have large-scale harm to the population at large.